What's the difference between developmental delay versus autism? Understanding these conditions is crucial for parents, caregivers, and professionals alike, as they can have significant implications for early intervention and support. While both autism and developmental delay involve developmental differences in children, they have distinct characteristics and require different approaches to assessment and intervention. Join us as we explore the nuances between these two conditions, shedding light on their unique features, diagnostic criteria, and the importance of accurate identification. Autism Spectrum Disorder, more commonly known as autism, is a complex neurodevelopmental condition that affects the way individuals perceive and interact with the world around them. It is characterized by differences in social communication, social interaction, and the presence of repetitive patterns of behavior, interests, or activities. As a neurodevelopmental condition, autism primarily affects the development of the brain and the nervous system. It is present from early childhood and persists throughout a person's life. The term spectrum in autism acknowledges the wide range of symptoms, abilities, and challenges that individuals with autism can experience. Neurodevelopmental conditions, including autism, are related to atypical brain development that occurs during prenatal development, infancy, or early childhood. They are not the result of individual choices, parenting styles, or environmental factors. Autism spectrum disorder can have a profound impact on various aspects of a child's life. Here are some key ways in which autism can affect a child. Social interaction. Autistic children often struggle with social interactions and developing relationships. They may find it challenging to understand and respond to social cues, such as facial expressions, eye contact, or body language. Initiating and maintaining conversations can be difficult, and they may struggle with taking turns or sharing interests with others. Communication. Language and communication difficulties are common in children with autism. They may have delays in speech development or experience challenges in expressing their thoughts and feelings. Some children with autism may rely on alternative forms of communication, such as gestures, pictures, or assistive devices. Sensory sensitivities. Many children with autism have sensory sensitivities, which means they may be over or under sensitive to certain sensory stimuli. Everyday sounds, textures, smells, or lights that may not bother others can be overwhelming or distressing for them. These sensitivities can impact their comfort and engagement in various environments. Repetitive behaviors and restricted interests. Children with autism often engage in repetitive behaviors or have intensely focused interests. They may display repetitive movements, such as hand flapping or rocking, and prefer routine and predictability in their daily activities. They may also have specific topics or objects they become deeply absorbed in. Executive functioning challenges. Executive functions involve skills such as planning, organizing, and problem solving. Children with autism may have difficulties with these higher-level cognitive functions. They may struggle with transitioning between tasks, managing time, and adapting to changes in routines. The spectrum nature of autism means that individuals can have varying degrees of impairment and unique strengths. While some individuals with autism may require substantial support in their daily lives, others may have exceptional abilities in areas like mathematics, music, or visual thinking. Some common signs and behaviors that may indicate the presence of autism in children include social communication challenges such as speech delay or limited development of spoken language, difficulty initiating or sustaining conversations, impaired understanding of nonverbal cues, such as facial expressions or gestures, lack of eye contact or difficulty maintaining eye contact during interactions, difficulty engaging in imaginative play or sharing interests with others. Social interaction difficulties may present with difficulty forming and maintaining relationships with peers or making friends, limited interest in or awareness of others' emotions or perspectives, preference for solitary play or engaging in repetitive behaviors instead of social interactions, difficulty understanding and following social rules or norms. Repetitive behaviors and restricted interests may present with engaging in repetitive movements, such as hand flapping, rocking, or spinning. Insistence on sameness and resistance to changes in routines. Intense focus or preoccupation with specific topics, objects, or activities. Highly structured and repetitive play or behaviors. Sensory sensitivities may include over or under sensitivity to sensory input, such as noise, light, textures, or smells. Reacting strongly or displaying distress to specific sensory stimuli. And seeking or avoiding certain sensory experiences. Developmental delay in children refers to a condition where a child does not meet the typical developmental milestones expected for their age. The developmental milestone is a specific skill or behavior that is expected to be achieved by a certain age range in a child's development. It involves a delay in one or more areas of development, such as gross motor skills, fine motor skills, language and communication, cognitive skills, social and emotional skills, or adaptive skills. Global developmental delay is a term used to describe a significant delay in multiple areas of a child's development, unlike specific developmental delays that may affect only one aspect, such as language development or social skills. The causes of developmental delays can be diverse and may include genetic factors, premature birth, prenatal exposure to toxins or infections, birth complications, environmental factors, or unknown reasons. Recognizing the signs of developmental delay is crucial for early intervention and support. Parents of children may notice a delay in achieving developmental milestones, such as sitting up, crawling, walking, or speaking. Other red flags may include difficulty with fine motor tasks, limited social interactions or communication, developing at a slower rate to other children, delayed or limited language skills, or challenges with problem solving or attention. Developmental delay disorders encompass a range of conditions in which children experience delays in their developmental milestones. These disorders can affect various areas such as motor skills, language and communication, cognition, and social interaction. Here are a few notable examples. Autism Spectrum Disorder. Autism is a neurodevelopmental disorder characterized by challenges in social interaction, communication, and repetitive behaviors. Individuals with autism may have difficulty understanding social cues, expressing themselves verbally, and forming relationships. Attention Deficit Hyperactivity Disorder. ADHD is a neurobehavioral disorder that involves difficulties with attention, hyperactivity, and impulsivity. Children with ADHD may struggle to sustain focus, control impulsive actions, and exhibit restlessness or excessive activity levels. Intellectual disability. ID is a condition characterized by limitations in intellectual functioning and adaptive skills. Individuals with ID may have challenges in areas such as problem solving, learning, reasoning, and daily life activities. Speech and language disorders. These disorders encompass various difficulties in speech and language development. They can include conditions such as articulation disorders, which refers to difficulty with speech sounds, receptive language disorder, which refers to difficulty understanding language, and expressive language disorder, which refers to difficulty expressing thoughts and ideas. Global developmental delay and autism are distinct but related conditions that affect child development. Let's break down some of the key differences. Global developmental delay refers to a significant delay in two or more areas of a child's development, including cognitive, motor, speech and language, and social skills. It is typically diagnosed in children under 5 years of age, when their developmental milestones are significantly delayed compared to their peers. Global developmental delay is a broad diagnosis that indicates a delay across multiple areas of development. The causes of global developmental delay can vary and may include genetic factors, prenatal complications, birth injuries, or environmental influences. Young children with global developmental delay may eventually catch up to their peers or continue to experience developmental challenges as they grow older. Autism is a neurodevelopmental disorder characterized by difficulties in social interaction, communication, and the presence of repetitive behaviors or restricted interests. It is typically diagnosed in early childhood, often around the age of 2 or 3, based on specific criteria outlined in diagnostic manuals like the DSM-5. Autism is considered a lifelong condition, and its effects can vary widely from mild to severe. Each individual with autism has a unique profile of strengths and challenges. The causes of autism are complex and involve a combination of genetic and environmental factors, though specific causes are often difficult to pinpoint. Children with autism may exhibit difficulties in social communication, such as limited eye contact, challenges in understanding and using nonverbal cues, and difficulty in forming and maintaining relationships. While global developmental delay and autism spectrum disorder share some overlapping characteristics, global developmental delay is a delay across multiple developmental domains, while autism is one of the developmental delay disorders that specifically addresses difficulties in social communication, interaction, and the presence of repetitive behaviors. The treatment approaches for global developmental delay and autism share some similarities. In both cases, early intervention plays a critical role to prevent significant delays. For global developmental delay, treatment focuses on addressing the areas of delay through therapies, such as language and speech therapy, occupational therapy, and physical therapy. The aim is to improve cognitive, motor, speech and language, and social skills to help the child catch up to their developmental milestones. For autism, interventions often include behavioral therapies such as applied behavior analysis, which targets specific behaviors and social communication skills. Language and speech therapists, occupational therapists, and a developmental pediatrician are also commonly used to address the unique challenges faced by individuals with autism. Additionally, individualized educational programs and support services are important for facilitating academic and social development. It is important to note that the treatment for both global developmental delay and autism is highly individualized, taking into account the unique strengths, challenges, and needs of each child. Regular monitoring, parental involvement, and a multidisciplinary approach involving healthcare professionals, educators, and therapists are crucial for providing comprehensive support and maximizing the potential of children with global developmental delay and autism.